Awesome. All righty. Hello, everyone. It's so great to see you all here. My name is Melissa Kochanowski, and I'm the Programs Manager at PFIC Network, and I'm super excited to be sharing this new project with all of you. Quick overview of what we'll be going over tonight. We'll be taking a deep dive into our new project and sharing a bunch of information with you about it. We'll be introducing you to our project team who will be carrying it forward. And then we'll make some time at the end for questions and comments. So if you could just please hold your questions until that time and stay on mute, it'd be super appreciated. All right, so let's dive right in. A little background about our project. PFIC Network has recently received an award from the Patient-Centered Outcomes Research Institute, or PCORI for short. This is a U.S. government-sponsored nonprofit whose mission is to address the challenges clinicians and patients experience in getting their daily healthcare questions answered. They fund research studies and convenings that are patient-centered, and the particular award that PFIC Network has received is to prepare for patient-centered outcomes research in our patient and researcher community. So patient-centered outcomes research is a type of research that compares different treatments, but from the patient perspective. So it evaluates treatments and factors that matter most to patients, such as their needs, values, and priorities. Another central aspect of patient-centered outcomes research is that patients are involved in the entire research process, from study design all the way to even crafting the research question itself that the study is going to explore. The goal of patient-centered outcomes research is to generate knowledge that will help improve healthcare decisions. So this information could be used by patients and their doctors when they're evaluating different treatment choices. We were inspired to pursue patient-centered outcomes research project by conversations that were had at our 2022 Family and Scientific Conference. A lot of parents expressed that they felt uninformed in their treatment journeys, that it was very challenging to choose between treatment options for their kiddos, particularly when there was limited clinical care guidelines for the management of PFIC, but also it was unclear how patient preferences are factored into treatment decisions. This is where patient-centered outcomes research can help to address these challenges. And this is also what inspired us to design our project Impact. And with this project, we are going to prepare the PFIC community for patient-centered outcomes research. This is going to be a 2-year project that will run from now, 2023, July, August, and until July in 2025. And we're going to prepare the community in a few ways by empowering and educating patients to play an active role in research. We're going to craft guidelines for how to conduct research as partners. It's kind of a new frontier for patients and researchers to conduct research together. And we're going to explore ways that we can do that in our community sustainably. We're also going to identify our community's research priorities. So what types of questions are most important to our patients and families that we'd like to explore together? And of course, this project is for you, our PFIC patients, parents, healthcare providers, and researchers. And we'd love for all of you to be a part of it with us. So that being said, what sorts of activities will we be doing together over the next 2 years? We're going to start out by learning a lot more about patient-centered outcomes research. What I just mentioned earlier just touched the surface. So we're going to be conducting online self-guided learning modules and then discussing that module content in focus group meetings together so we can truly soak in and understand how this type of research applies to our community. We're also going to understand patients' values and priorities by building an interactive web app. This app is going to have clinical information about the different treatments, and it's also going to solicit patients' experiences with those treatments. I should mention that those are the objectives for the first year of the project. And now, going into our second year of the project, we're going to use those user responses from the web app from patients regarding their experiences with treatments to design patient-centered research questions. We'll also discuss these questions within the focus group meetings. We'll also produce guidelines for conducting patient-centered outcomes research by doing feedback surveys and discussing those results amongst our community members to reach a consensus for how we can best conduct PFIC patient-centered outcomes research. Ultimately, by July of 2025, at our project completion, we want our community, or we plan to have a community, be ready to pursue our first patient-centered outcomes research study together. I'd like to make a quick note that our project title, IMPACT, is actually a really cool acronym that stands for Identifying Research Targets by Merging Patient and Clinician Treatment Information. This is actually what we'll be doing with a web app, which is going to be a really awesome deliverable that we're going to create together. And that we'll share a little bit more about later when I introduce the web developer that'll be helping us create it. Awesome. So with all that being said, a little bit of information about how you can look out for upcoming activities as we get started. Definitely make sure you're subscribed to the PFIC Network newsletter. We'll be sending out updates about project activities via email and also our social media. The first activities that we'll be kicking off the project with are the first learning module and the first focus group meeting. The module will go live in early August, and then we'll have one module every 4 months after that. Each one will be roughly 25 to 30 minutes to complete, and they'll include a learning part and then also a survey part at the end. If you complete the full module, you can receive a $30 gift card. We'll be able to provide those for the first 30 people that complete the modules. We had to restrict the number because of the project budget from PCORI, but we still highly encourage everyone to participate in the modules because they're super valuable and super interesting. And then our first focus group meeting will occur after that module in later August. And then following that, they'll be scheduled every other month. Each focus group meeting will be about an hour and a half long, and we'll have about 15 people max per meeting attend, about 10 patients and parents, and 5 researchers. And all the focus group participants will receive a $90 gift card for each of the focus group meetings that they participate in. I'd also like to make a quick note. We'd love for patients, adolescent patients, to participate, particularly in the age range of 14 to 18. They'll just need to provide assent and their parental consent. All right, I'm almost done talking. So I'd love to now introduce all of you to our amazing project team. You might recognize many of these folks for the incredible work they've done for our community for research or peer support, or even some of our initiatives like the registry at PFIC Network. Really quick, like I said before, my name is Melissa. I'm the project lead for Impact. I'm really looking forward to working with everyone the next couple of years to coordinate our activities and to produce materials for them. I'd now like to introduce project co-lead Gita Lupke. She's the science advisor at PFIC Network and has been instrumental to setting up our successful new patient registry. And Gita, I'd now like to take the mic.
Okay, yeah, thanks, Melissa. So yeah, my name's Gita, and I will be co-leading the project together with Melissa. I'm a retired professor. I used to work at the University of Notre Dame in what's called quantitative psychology. And that's basically statistics, but then with a focus on psychological or psychiatric data. I mostly worked on the genetics of psychiatric disorders and machine learning to figure out genes that were related to psychiatric disorders. Anyways, my connection to PFIC, though, is through 2 of my friends whose daughter has PFIC. And one of those friends is on the call tonight. That's Emily Ventura. And as you know, she leads PFIC Network. And so since the birth of Emily's daughter, Cedar, I've been like loosely following PFIC research, like reading, well, as far as I could understand them, PFIC research papers. And it's fascinating. It's pretty amazing how much knowledge has been gained just in the last 10 years in the area of PFIC. So, I mean, I love research, right? I'm a researcher, or at least used to be. I love it because it's so cool what you can figure out when you investigate something in a systematic and organized way, right? And that knowledge that you can gain, it can be really making a difference. A lot of current PFIC research is focusing on the clinical and genetic aspects of PFIC, and that's of course very important. But as Melissa has pointed out, what Project Impact is trying to add here to the existing body of research is research about PFIC treatments that look at outcomes that are directly relevant in the daily lives of PFIC families. So that's kind of like a new aspect that we want to accomplish here. And for that to happen, we really need to hear from you. We need to hear what's most important to you when it comes to your treatment journey. Every treatment journey is different, so we need your information. You can help us make this project a success by participating in the focus group meetings and by completing these educational modules that Melissa mentioned. Now, they explain the basics about patient-centered research, right? So research is just a job, just like any other job. You need to learn a couple of things to know what you can actually do in research, what's feasible, and also what you can expect from a research study, right? So to have realistic expectations, all of that will be provided in these educational modules. They are, as Melissa said, they're like 10, 15 minutes long, and they're followed by the feedback surveys. And those will be really important for the project because that is the information that you give us about your experience with PFIC treatments. So yeah, I hope that you will participate and that you will be just as excited as we are, because we are really ready to go. I think this is an amazing opportunity to design research that's directly relevant to PFIC patients and their families. And with that, I give the word back to Melissa.
Awesome. Thank you, Gita. All right. I'd now love to introduce one of our focus group facilitators, Alexandra Perez. She is the Community Advisory Council Chair at PFIC Network and also an incredible superhero PFIC mom. Alex, if you'd like to unmute yourself and take it away.
Well, thanks, Melissa. Thanks for calling me a superhero. Hi, I'm Alexandra Perez, and I'm from Edmonton, Alberta, Canada. And I have 5 children, along with my husband, Walter, and our second-born son, who is now 6. He has PFIC 2, and he was diagnosed when he was about 6 months old, and he's currently doing really well. He's on one of the drug trials, and it's just taken away his itch completely. So we are very happy with his quality of life right now. So that's been great. And I'm excited for this project because I think this is exactly what we would have loved to see when our son was first diagnosed, because we were just lost. Our doctor didn't have the answers. They had like partial information. I spent many nights on Google looking up everything and not understanding 3/4 of it. So yeah, I'm excited for that. And as Melissa said, for this project, I'm going to be one of the focus group leads. So I hope to see you all at the meetings.
Thank you so much, Alex. And now for the other focus group facilitator, Dr. James Squires, or Jim, I think is what he likes to be called. He is from the Children's Hospital of Pittsburgh and is also a member of the PFIC Network Medical Advisory Board and has been a part of a lot of amazing initiatives at our organization, such as our annual conference. Jim, you'd like to take it away?
Yeah, thanks, Melissa. Yes, Jim is what I like to be called. So I appreciate you calling me Jim. Again, as Melissa mentioned, Jim Squires, I'm one of the hepatologists at the Children's Hospital of Pittsburgh. Just by way of background in my move towards being interested in PFIC, obviously the PFIC disorders are rare liver disorders that we do see and care for. I saw them in my training in Cincinnati, and since being in Pittsburgh in particular, have really developed a clinical interest, particularly for the FIC1 deficient patients, the Byler's patients. For those of you who know that name, the Byler's were a Lancaster, Pennsylvania Amish family, and we care for many of the original Byler descendants. And so I have whole groups of patients that we care for. And so that really is where my kind of clinical interest in PFIC was born out of. I was lucky enough to cross paths with Emily and this great organization, I think from its founding, and have been honored to be on the medical board, really helping them, with the amazing work that they've done. And as Melissa noted, I've been able to, be involved from their, the family conferences, which are an amazing opportunity where I've met many of you at. I got to work with Alex at the last one specifically. I think we worked together on the Chan Zuckerberg Award that the network got several years ago, that I think has laid the foundation for many of the amazing things that the network has done. And I'm really excited to see where impact takes us. I think you'll hear from my colleague Emily Perito here in a little bit. I think my interest in PCORI efforts has stemmed from work that really Emily has led in another network that we collaborate in that has a specific focus on liver transplant. And so there has been some overlap with several PFIC families, and we have looked to kind of identify, patient-centered outcomes research that will be of interest both to the clinicians who care for patients as well as the patients that we care for. And so again, just want to reiterate the excitement. I think this is got a really great leadership team with Melissa and Geeta, and I think I'm very excited to see where this project goes over the next 2 years. And if there's anything I can help answer or do for anybody on the call, please reach out. Thanks, Melissa.
Thank you, Jim. And I just want to note that Jim's experience with the patient-centered outcomes research project for transplant families, we've learned a lot from that project, and we're really thankful to Jim and Emily Perito for sharing their knowledge and experience to help us craft this project for our community, which has a lot of overlap considering it's transplant. All right. Next, I'm going to introduce our community liaison, Emily Ventura, who many of you may know as our Executive Director of PFIC Network. Emily is going to play an important role in connecting this project with our community of patients, researchers, our board of directors, our medical advisors, and really connecting this with our larger strategic goals and vision as a community. Emily, would you like to take the mic?
Sure. Thanks so much. So again, my name is Emily Ventura, founder and executive director, I should say co-founder and executive director of PFIC Network. I also am a parent to an 11-year-old girl with PFIC type 2. She is doing quite well. She does experience recurrence of disease post-transplant, which happens in a small subset of patients. So I guess she is the lucky/unlucky one of those. But again, overall doing quite well, and grateful to be here and, a part of leading this network. I'm just really excited that everyone's here. In my day-to-day, I get to talk with patients in the community and with researchers in the community. I have that wonderful role. And so I'm excited that Project Impact now bridges that gap and brings together the entire community. Because to me, that's so rewarding as a parent to be able to have those conversations on a day-to-day, especially in a rare disease. And so now, I'm excited that our community will be afforded the same opportunities. I'm grateful to those who are participating in the project team, that you're focusing your efforts and your expertise on our patient community, because we're rare, but there's so much to be learned, and we need your help So thank you for spending your time with us. And then obviously to Geeta and Melissa for putting together such a fabulous program and for bringing together this wonderful team. I'm really excited to see where the project goes. So.
Thank you so much, Emily. Fun fact, I actually met Emily and got to know about PFIC because of rock climbing. Her and her daughter are both amazing rock climbers, and her passion for sharing and spreading awareness about this disease really ignited a fire within me to help and get involved and be a part of this community. So thank you so much to Emily and all the amazing PFIC parents out there that were getting involved in this project. I'm really excited to create this together with you. And now for our awesome web platform developer, Paulo Catala from PowerWorks. Paulo is really going to be instrumental into producing this web app that we are going to create together, where we're going to merge the clinical information with patient experiences. And it's really going to be an awesome tool, and Paulo's going to bring it to life. And so I'll allow Paulo to share more about how we'll get involved in this project.
Yeah, thanks, Melissa. So yeah, I'm Paulo Catala. I'm a Michigan-based designer and creative. My connection to PFIC is like a little bit random and related to rock climbing. I'm not a rock climber, but my mentor back in college at the College for Creative Studies in Detroit, this was like, I mean, our relationship goes back probably like 13 years now, but she met Geeta on a rock climbing trip, and we were introduced that way, and then now we're here. So I'm excited to be a part of this because like the outcome of this is good and is impactful. And just like in the design industry that I work in, it's very centered around like advancing commercial businesses, and it's not very often I'm able to put my energy towards something that is actually positively impacting others. And I just love the opportunity to do that. And also, I'm a father of 3 young kids. One of them falls under a rare condition category. So as a parent, I can relate to just like the stress of the unknown and lack of resources out there, and like even from like medical professionals. So like, I think it's really great that this tool is being developed from a community perspective and then also from a research perspective. So it's like this model that's really great for this like perpetual growth, and I think that's awesome. So in this project, I'll be handling the creative and development aspects. So from a creative standpoint, pretty much taking all of the focus group data and reinterpreting it into like a different form that's very digestible, user-friendly, and engaging, which will take the form of the app. So that'll involve designing the user experience of the platform, like how people interact with it, creating a narrative around it, and then actually designing the interface that people interact with and making that as engaging and impactful as possible. And then lastly, the development side of it, so actually bringing it to life. And then ultimately the outcome of the design will be dictated by all the research and participation. So the end product will truly be like this big collaborative effort that has everybody's hands in it. So I think that research and design and community participation is like what makes design impactful, and I'm excited for that.
Awesome. Thank you, Paulo. We're super excited to have you on board. And we're really looking forward to, like you said, bringing this creative vision to life through a collaborative effort. Alrighty. And for the last person on this list, we will be having Dr. Emily Perito on the project team as our patient-centered outcomes research consultant because of her extensive experience through her project with Jim for transplant families. Emily, would you like to introduce yourself?
Sure. Hi, I'm Emily Perito. I am a pediatric liver doc at UCSF in San Francisco. So I take care of kids with PFIC and lots of other liver diseases. I've worked, as mentioned, with Jim on a very similar project in a network that we have that's focused on pediatric liver transplant. And so hopefully my experience there can be helpful to you guys as you work through this in the PFIC community.
Great. Thank you so much, Emily. I'd just like to note really quick that a couple other members not listed here that have committed their involvement in the project as researchers in the focus groups include our Dr. Ben Schneider from our medical advisory board, and also Dr. Aki from Cincinnati Children's. We're super looking forward to having you all part of the project. I don't know if I see Aki here. That is quite all right. Okay. I'd now like to open up the floor for any questions, comments, feedback that any of our community members have about the project. Please feel free to unmute yourself or drop whatever you'd like to say in the chat.
And again, maybe while people are just kind of thinking of questions or wondering how best next to kind of ask questions, I would kind of building on the experience that Emily and I have with similar projects in transplant. I would really just encourage folks to recognize the power of their participation, and that these projects really depend on you guys and your involvement. I think PCORI, as was noted by Melissa, that they are very committed to recognizing and respecting everybody's time. And so there is generally, compensation for your involvement at the various different levels. It's important to recognize that if you miss one module, that doesn't mean that, you can't participate in further modules. You can always go back. You can always kind of re-engage. And so, I think I just want to really, stress the importance of, this is one of those scenarios where there really isn't any, silly question or, level of participation that is too little or too much. Anything is helpful, and it really does kind of help frame and shape the whole of the project. And so, again, very excited for this project to move forward, but want to make sure that everyone knows that whatever they can give is really going to be impactful for us, no pun intended, but to really kind of shape the project as it moves forward.
Thank you, Jim. That's a really important thing to point out. And I also just want to say, I actually made a joke with Emily before this call about whether I should bring up an impact pun, and I decided against it. So I respect you for doing it.
I've got dad jokes aplenty, Melissa. Don't worry.
We'll have to connect.
Melissa, maybe it would be good to just share a little bit about how, just kind of reiterate how folks can participate in the modules and in the focus groups. Will you be inviting? How will people see that information? Maybe just explain a little bit more about how to participate.
Absolutely. That's a really great question. So like I mentioned before, we'll be sending information and announcements about project activities through emails and social media from PFIC Network. And these will provide, the timing of these activities. For the modules, it'll be self-guided. So once they're live, you can click in at any time of day, whenever you'd like, and complete them at your own pace. And then for the focus group meetings, those will actually be scheduled to be live, like our meeting now, at a particular time. And those you will need to register for. It'll likely be a Zoom link that you'll enter in your email like you did for this webinar. And then we'll have that, like it'll be a 1.5 hour meeting, like, sorry, like I mentioned before. I think I should clarify that both patients and researchers will be participating in both the modules and the focus group meetings. Or as I say, we invite participation from both groups. Patients being, kiddos that are diagnosed with PFIC ages 14 and up, parents or caregivers, and then for healthcare providers, that includes nurses and support team, the clinical support team, and then researchers, of course. And we'll have, module content tailored to each group and survey questions tailored to each group. And then we'll also have, breakout sessions within the focus group meetings for each group.
Sorry. Hi all, I'm Charmaine Gravener. I have 2 kids with PFIC 2, 18 and 15. Should we be reaching out then to our clinicians as well to possibly participate? Or am I misunderstanding what you're asking for?
Yes, absolutely. That would be great to invite your clinicians to participate. There's, while the focus groups, we're capping the number at 15 members, it's still really, the modules are great for anyone to participate in, and your clinician may be within that, while we're capping at 15, they might be a part of that number that is participating.
You could just connect them directly with Dr. Jim Squires there, and he can be the clinician liaison. He'll bring them all in.
I've got multiple hats that I wear, so yes.
Just send them all your way?
Sure, absolutely. Would love to talk to anybody.
Okay, I'll reach out. Thanks.
That is my role as community liaison. Send them to Jim, liaise from there.
Yeah, and the more PFIC patients and healthcare providers and researchers we have, the better, because then the more we can hear from our community, and the more we can grow our community together to prepare for participating in research, designing patient-centered outcomes research. But also it allows us to better understand, we get feedback from more people, we get an even more clear idea of what matters most to the PFIC community from all angles. So definitely, if you know other PFIC patients or families, to our clinicians and researchers, if you can, we're planning on putting together an infographic about the project. We'd love for you to share it with your centers or your patients in any way that you can appropriately do so. That would be fantastic. Like Jim said before, engagement is key. We love everyone to participate. Let's see, I'm going to check the chat really quick. Does anyone else have any more questions or even just comments about, after hearing this presentation, if you are, excited about any particular aspect?
Also, maybe to add, we will have on the PFIC Network website, there will be a specific page for project impact. And if you have any questions in the future, our contacts will be on there. And yeah, all the information about the project will also be on the website. That will be easy to find on the general PFIC Network website.
Thank you, Gita, for sharing that. And we'll share when that web page is live through our email and social media. And like Gita mentioned, if you end up having any questions or would like to express interest in participating, please feel free to contact us. I put my email here on the slide, but we'll also have more contact information on our website going forward. All right. Well, unless I'd like to provide the opportunity for anyone of the project team to make any closing comments before I wrap up the call.
I mean, I'll just jump in and, again, reiterate how excited I am that everybody's here and, willing to participate in this project to, for efforts directly related to the PFIC community. It's much needed, and we very much appreciate the support. I'm excited to provide this opportunity for community members in particular. I think it's a wonderful, initiative, and, in what can sometimes be a very hopeless situation, just having the opportunity to talk to others, especially clinicians and researchers who understand the disease, to be a part of that conversation and a seat at that table is so valuable. So thanks again, and I'm really excited to kick this off.
Awesome. Thank you, Emily. And thank you so much to everyone who joined our call tonight, including our project team members and our community members. So look forward to working on this project with all of you over the next 2 years, and you'll be hearing from us soon. Have a great night,
you.
everyone.
Bye.
Thank you.
Thank you.
Good evening.
See everyone.
Bye.
Goodbye.